everybody, this is Dr. Radhika Meka from Parampara Fertility and Gynec Center. Today I'll be talking to you about HSG test, hysterosalpingography. Why we do a HSG test? If you're failing to conceive after long years of married life, one of the causes could be blocked tubes. So the blocked tubes are checked by the HSG test. HSG test is done usually on day 8 to day 10 of your menstrual cycle. So you come into the hospital with having light meals. Once you come in, we give you an injection. It's an antispasmodic injection half an hour before the procedure. After giving the injection, you're taken into the X-ray room. You lie down on your back with your hips and knees flexed. We put a small instrument called the speculum, look into the lower part of the uterus, what we call as a cervix. We put a cannula inside and then we put the dye inside. Once the dye is passed, the X-ray technician is called in and we ask him to take X-rays of your pelvis. Once the procedure is done, all the instruments are taken out and you're left to rest for a few minutes. The X-ray is then viewed and we look into whether we see any blockage in any of your tubes. We can also see whether there are any uterine cavity problems. So this will help us to decide the treatment. So HSG is a basic test to check on your tubes. If the tubes are blocked, both the tubes are blocked, then you might need advanced treatment like IVF ICSI. But if tubes are fine, you could either try natural or go in for an IUI. If one tube is blocked, then still you have an option of going for IUI. If you're younger, you could try an IUI, but if you're older, then it's better to go for advanced treatment. HSG test is a small test lasting for 5 to 10 minutes. Might cause a bit of crampy pain, but we give you injections to prevent that. We would give you a course of antibiotics after the procedure. Half an hour to 1 hour after the procedure, you could go home. So this will help us to know whether there are any tubal blocks or uterine cavity abnormalities. Any questions regarding this test, you could put it down in the chat box. I'll be very happy to get back to you. Thank you.